Did you know a single virus can wipe out entire poultry farms within days? Let's understand avian influenza, also known as bird flu, in the simplest way. Avian influenza is a viral disease that mainly affects poultry as well as pet, zoo, and wild birds. The cause of avian influenza is Influenza A virus, which belongs to the orthomyxovirus group. These viruses are classified based on two surface proteins, hemagglutinin and neuraminidase. There are many subtypes such as H1 to H16, H19 and N1 to N9. Most strains are low pathogenic, but some H5 and H7 strains can mutate into highly pathogenic forms. The incubation period of avian influenza ranges from a few days to about 2 weeks. The virus spreads through inhalation or ingestion of contaminated materials, especially feces and respiratory secretions. Movement of infected birds, contaminated equipment, and poor biosecurity are the main causes of spread between farms. In recent years, infections have also been reported in animals like cattle, cats, dogs, foxes, and marine mammals. In pets, infection can occur through eating raw infected meat or milk. Although avian influenza mainly affects birds, it can rarely infect humans through direct contact with infected birds. Human-to-human spread is very limited. Symptoms are mainly respiratory, sometimes with conjunctivitis. Avian influenza exists in two main forms. Low pathogenic avian influenza, which is found worldwide in wild waterfowl and shorebirds that often carry the virus without showing disease and act as natural reservoirs, and high pathogenic avian influenza, also called fowl plague, which usually arises from mutation of certain low pathogenic avian influenza strains, especially H5 and H7. Clinical signs in birds vary depending on the virus type. Low pathogenic avian influenza, causing mild or no signs such as slight respiratory disease and reduced egg production. High pathogenic avian influenza, which is severe with organ damage and very high mortality up to 100%. This may cause sudden death or signs like swelling and discoloration of the head, comb, and legs, hemorrhages, diarrhea, and nervous signs such as paralysis or incoordination. Diagnosis cannot be made based only on clinical signs and must be confirmed through laboratory testing. Tests include detection of viral RNA using PCR, identification of viral antigens, or isolation of the virus from samples like throat or cloacal swabs. Low pathogenic avian influenza must be differentiated from other respiratory and production diseases such as infectious bronchitis, infectious laryngotracheitis, Newcastle disease, and bacterial infections. High pathogenic avian influenza must be distinguished from other causes of sudden high mortality like severe infections, heat stress, or dehydration. There is no specific antiviral treatment recommended for avian influenza in birds. In low pathogenic avian influenza cases, supportive care such as improving temperature, nutrition, and using antibiotics to control secondary infections can help reduce losses. However, in high pathogenic avian influenza outbreaks, infected flocks are usually culled to prevent spread. Avian influenza is best prevented through strict biosecurity measures that keep the virus out of poultry farms, along with immediate reporting of suspected cases. Vaccination, when properly matched to the virus, helps reduce disease, death, and spread by lowering virus shedding. Effective control combines vaccination, good farm hygiene, monitoring, and culling infected bird. In simple words, early detection, strong biosecurity, and quick action are the keys to stopping avian influenza and protecting both animals and humans. If you found this video helpful, please like, subscribe, and click the notification bell for more Vetcare updates.